Sure. So I'm going to repeat the question. He's a trainer. He's in a fitness environment. Patient has been through physical therapy. They've been released by their physical therapist. They're obviously not 100%. They've been released for some reason or the other. They don't want to go anymore. Their insurance doesn't compensate or reimburse anymore. Either way, you know they're not back to full function, and they may even be still in pain, but yet they're asking you to make them fit. And believe it or not, there is a subconscious contract. They're hoping you will make them well as well. One of the things you may want to do is draw some alliances in here with some clinicians who get where you are, because I have many times when people have exhausted their insurance and everything like that, have worked closely with a personal trainer and said, listen, don't want you to do anything upper body, over the head, keep the cardio up, keep the flexibility up, lower body stuff is fine. I will need them to see me once a week, and I'll try to keep it brief. And if there's ever a time when we can quit doing our stuff and you can take over, we will. And sell it to them. You got to sell it to them. You got to find a clinician that's not going to waste your time or theirs, and sell it to them. Yep. And that's exactly what we used to do. He would say, get clearance from the PT, write a bunch of restrictions. That is the second best way to do it. But you know, if you basically go a little bit deeper, you'll find out those limitations can easily change with a different system. A different system of how you treat, how you train, and stuff like that. So in the old world, I mean, when I came out of school, I mean, first job I had other than bartending was personal training. A lot of the same psychological things. If you're successful at one, you can be successful at the other, okay? But my point was, we would have people who had issues with squatting, and we thought the solution was leg press, quad extensions, and hamstring curls. And it wasn't. There was an entire core, hip, leg disconnect. So anything we did to strengthen the lower body only reinforced the problem. So, you know, nowadays you may see people who have problems with squatting, well, we're going to have them working on their active straight leg raise, and maybe quadruped diagonal. Doesn't make a lot of sense because it doesn't look like squatting. But all that stuff occurred before you ever squatted, and from a neuromuscular standpoint, it makes a lot of sense. And so just basically, you can work with people with issues without them seeing a therapist or a chiropractor 3 days a week. They can see it once every 2 weeks, but now you guys are working as a team. If there is a problem, there's a phone call away. So that's what I would say is the solution to that. Because we will always be able, and we could fill up the next day with stories about, you know, from a clinician, this trainer screwed somebody up, or a trainer saying, this person shouldn't be discharged yet. We can find those stories all along, and that's pretty much why he and I give up weekends away from home. Can't change talking about it. You know, you got to do something about it. So.